Noon. My name is Yazid Moore. I'm the Director of Michigan Programs at the W.K. Kellogg Foundation. I'd like to welcome the members of the press corps and thank you for your attendance as we talk about what's at stake, the challenges facing Michigan families. At the W.K. Kellogg Foundation, we're driven by the vision of a world where every child has the opportunity to thrive. We all want Michigan to be the best place in the country to live, work, and raise a family. Our state future depends on strong families, but right now, that future is at risk. Michigan families are struggling to keep up with rising costs. As an example, a recent statewide EPIC MRA poll supported by the W.K. Kellogg Foundation and Steelcase Foundation found that more than 1/3 of Michigan voters say the cost of food and groceries is the biggest challenge for their family. When families can't afford groceries, childcare, housing, healthcare, and other basic necessities, Michigan's workforce, economy, and communities pay the price. To share new data about how Michigan families are doing at this moment, please welcome Elliot Haspel, Senior Fellow at the independent think tank Capita.
Thank you, Sazid. Michigan families under enormous strain. 41% of Michigan parents with young children said in the last 12 months they borrowed money, took on debt, or used payday and advance products to cover basic needs. It's just one data point, but from borrowing money to cover groceries, skipping doctor's visits because childcare fell through, Michigan families are navigating a complex web of financial strain, job insecurity, and unmet healthcare needs. Before I dive deeper, let me tell you a little bit about the research. Capita is an independent think tank and learning community focused on a future where all children and families can thrive. In April, we fielded, with YouGov, the second in our standing series of polls, Quarterly Insights from America's Families. We surveyed both a nationally representative sample of 1,000 parents with minor children and 200 additional Michigan parents with minor children. What we found is that Michigan's parents consistently report higher rates of debt, housing instability, and schedule volatility than parents nationwide. These pressures strain families who are already making daily trade-offs just to stay afloat. New financial pressures are also building, such as the rising use of online gambling and sports betting platforms. I'm going to go over some specific numbers now. Please keep in mind that the margin of error on the Michigan numbers is around 7%, so the exactitude of the numbers should be taken with caution. Directionally, however, they tell a clear story. In addition to Michigan parents taking on far more debt and using payday products at a meaningfully higher rate than the national average, 42% of Michigan parents said in the last 12 months they felt forced to take on additional hours of work, either by financial necessity or work pressure. Only 30% of parents nationally said the same. Michigan parents already underwater are being forced to work extra hours and stress themselves out more because they cannot pay the bills otherwise. 56% of Michigan parents said that over the last 2 weeks they were bothered by feeling down, depressed, or hopeless at least once. That compares to only 49% of parents nationally. More than half of Michigan families, in other words, woke up in the last 2 weeks feeling like things might not get better. While every state has parents who are overwhelmed, Michigan's parents are notably having overwhelm at elevated rates. That gap is worth exploring further. There are also places where Michigan parents more closely reflect national averages but are still concerning. 34% of Michigan parents and 30% nationally had a work shift canceled, shortened, or extended with less than 24 hours notice within the past month. And notably, children don't experience this scheduling unpredictability simply as a workplace problem for their parents. They experience it as their parents missing a recital or a game, inconsistent bedtimes, or parents arriving home stressed and distracted. Similarly, 25% of Michigan parents and 20% nationally delayed needed health care for at least 1 month over the past year, and nearly a quarter of those did so due to child care challenges. Those delays are long enough for a treatable condition to become a complicated one or for a mental health crisis to deepen. Child care is not just a family issue, it's a public health issue. And among Michigan households that have had a family engage in online sports betting, fully 1/3 said they had at least once reduced spending on essentials, such as groceries, utilities, rent, or childcare, in order to place sports bets or to cover sports betting losses. This is similar to the 31% nationally. All told, Michigan families face myriad challenges. They're borrowing money to cover the basics, working hours they didn't want to work and can't afford to refuse, making nearly impossible trade-offs just to get by, and lying awake feeling like things might not get better. But the road ahead is not hopeless. I'm going to turn it over to my fellow panelists now to discuss solutions that address these real needs and can set all Michiganders up for success. And so I'm going to pass it over now To Monique Stanton, President and CEO of the Michigan League for Public Policy.
Great. Thank you so much, Elliot. So the theme of this conference is finding common ground, and yesterday's opening session was around the everything is burning down. And if we want to address issues that are critical to both our workforce and families, we need to start with child-centered and family-centered policies. So what this data shows us is that systems that were designed to support Michiganders are unraveling at very fast rates. These stats could be interpreted as healthcare problems, childcare problems, food problems, house problems, but they can't be isolated like that. Families and communities experience all of these things at once. We've talked to a lot of families in the past year about what they're facing right now. For instance, one mom in Livingston County talked about her experience. She works as a teacher's aide, providing really valuable work, and her husband is a disabled veteran and works in IT. When their middle son was 3 years old, he had a seizure, and overnight, their entire world changed. Today, her family is grateful for Medicaid because it provides care for her child, and she's critically concerned, or very much concerned about the potential losses to Medicaid and what that means for her life and for her family. Why should they have more of a right to live their lives than we do ours, is one of the things that she has echoed. If we lose Medicaid, her son truly loses the right to live and have a quality life. It's no wonder that more than half of parents feel down, depressed, or hopeless. Look at what we're up against. At almost 18% of kids in Michigan are living in poverty. That means that when you're raising kids and earning less than $30,000 a year, you aren't making it. You're not spending the quality time you need with your child because you're just struggling to be able to pay rent and put food on the table. And 41% of Michigan families don't have a survival budget. That is roughly $55,000 for a family of 3. That means they can't do the types of things that can truly enrich a child's life. Debt, unscheduled schedules, skipped doctor visits, uncertainty, and depression are all things that we're struggling with. They're all symptoms of the same problem. Economic instability and lack of support for families facing health and financial problems are on the rise. And rather than work to strengthen our safety nets, the current federal administration is dismantling them. Right now, as prices skyrocket and people are losing faith in our symptoms, we need to look at solutions that are going to build up Michigan families. We can create a fully refundable state-level child tax credit that targets the poorest kids and doesn't leave kids out because their families earn too little. We can do things like expanding RX Kids, which is a phenomenal cash transfer program that provides immediate cash for families and gives families the room to breathe so they can be there for their children. These are bipartisan issues that are widely supported in our communities, and we know that we can do these types of things in Michigan. We know that right now we need to do all we can to help Michigan families. It's critical in order to help grow our state and retain the population that we have. So I'm going to call one of our wonderful business leaders in Michigan, Andy Richards. He's the COO of Duncan Aviation, to talk a little bit about what their organization's doing.
Thank you, Monique. Good afternoon, everyone. I'm here to talk about childcare as a workforce development issue, workforce participation issue that's affecting employers like me all over the state of Michigan. How does it show up as a workforce development or participation issue? It's because people are actively deciding right now at companies like mine, and mine included, whether or not they're going to stay in the workforce because they either can't find and or can't afford quality childcare for their kids. I know I've lost people in the past due to this issue who've chosen to stop working. Others are thinking about it right now. And so this shows up as, even if they can find quality childcare that they can manage to afford, there may be issues with participating fully at work. If that childcare becomes unstable, they may be late to work. They may have to leave work early, may not show up altogether because of childcare falling through. And so this affects productivity, which affects my bottom line and the ability to keep employing people like them. And it's not just me. There's a lot of companies around Michigan that are experiencing this as well. And how do I know this? I know this because I've actually gone out and asked the question of my team members. who have spouses who work at other companies who are making these decisions. And so what we need to do first to understand the problem is listen to our employees and their families about the challenges they're facing with childcare. And then once we've gathered all that information, we need to take it inside and figure out what can we do about it within our companies first, and then also what can we do about it in the broader community. So for instance, in my company, we've instituted a few things that we think help with this burden, such as dependent care dollars as benefits for them, as far as paid family leave, and also a few programs such as we've recently committed funds to the RX Kids project in Michigan. Happy to be a part of that as a partner. And then also, we have a healthcare clinic in our company where people can come, employees can come and get healthcare, and also their spouses and dependents can get healthcare in our facility at $20 a visit. This is something that helps people stay at work, right? They don't have to take a half a day off to go to a medical appointment for themselves or their kids. But beyond what you do inside your company, if you're able to do those things, what can you do in the larger community? In order to figure that out, we have to work with partners. There's partners available, such as the Southwest Michigan Child Care Coalition, the ECIC, MyLeap, who are ready and willing to partner with companies like mine to figure out solutions to the broader community-based problems that we have. We've got programs that are in work right now at the local level, programs such as the millage that's being considered in Kalamazoo County. We've also got First Home, First Teacher in Battle Creek. And then we also have some wage boost ideas that are being floated around as possible solutions. The number one thing that I'm asking employers to do today is to engage in the conversation. Work with these partners who have these great ideas and figure out what's the best solution for everybody. But it takes, first off, listening. Not only listening to your people, but also listening to these experts that are in the field trying to make these solutions come to life. And so my ask is that employers engage like this. Lastly, there's a need for us to bring all of this collective energy together, all these ideas together in a central way, and have the state of Michigan act on this issue so that we can have a more collective solution to this problem that's so pervasive in our state. Thank you, and I'm going to turn it over now to Regina Bell, the Chief Policy Officer for the Council of Michigan Foundations. Regina?
Thank you so much, Andy. I really appreciate that. So Michigan Philanthropy has a long history of working in partnership with government and business to champion innovative solutions for Michigan children and families. We have seen this take shape in food assistance, direct cash assistance, expanding opportunities and access to early childhood education and beyond. Michigan's TRI-Share program exemplifies what we can accomplish when we actually work together. Launched in 2021 with the support of the W.K. Kellogg Foundation, the innovative initiative splits the cost of childcare a third between families, government, and participating employers for families who earn lower wages. In the 5 years since its launch, it's been replicated by other states and has inspired an approach at the federal level for a federal pilot. Bipartisan legislation was introduced by U.S. Representative Skolton and U.S. Representative John James that would set aside funding to launch a TRI-Share childcare federal pilot. Another landmark public-private partnership is RX Kids. And I know that folks have heard a lot about RX Kids today, and you will continue to hear more details about the program throughout the Mackinac Policy Conference. Through the support and vision of the Charles Stewart Mott Foundation, it launched in Flint in 2024 as the nation's first citywide maternal and infant cash prescription program. The program helps families afford essentials such as baby supplies, food, housing, childcare, and transportation to doctor's appointments. Through philanthropic support, the program is expanded in communities across the state. Foundations across Michigan are playing a very pivotal role as conveners, connectors, and bridge builders to elevate community voice in projects, program, and policy decision making. At CMF, through our statewide equity fund, a pooled fund driven by our members, we are working with foundations as they center community voice and ensure those closest to the issues are among the key decision makers shaping the solutions. Through our statewide equity fund strategic support pilot, community foundations in 5 regions work closely with their local units of government to help shape incoming federal funding to advance economic prosperity in their communities. Core to these efforts was gathering community members and ensuring that they were directly informing how the local dollars would be used. In Marquette, the leadership of the Community Foundation and through the partnership with the county, this work led to the creation of the Childcare Spark, which is designed to build a pipeline of childcare providers who can offer high-quality, economically viable, and financially sustainable care services for families in the region. Another impactful partnership connected to our statewide equity fund and forged through the work of the Governor's Office of Foundation Liaison is CMF's partnership with the Michigan Department of Natural Resources. Through this unique partnership with DNR, we've been allowed to use an approach to grant making that's really different and unique. It focuses on removing the barriers to federal funding for communities that have been historically under-resourced and underserved. The program focuses on centering community voice and engaging a diverse array of community stakeholders, both in the development and activation of park and recreational assets in the community. Additionally, we've been able to walk alongside communities in providing equity-focused technical assistance support. These are but a few examples of the power of public-private partnership and what's possible when we all work together to make our state vibrant for all Michigan residents to live, work, and play. Partnerships are essential, and philanthropy, though, cannot fill the gaps created by funding uncertainty. While our sector is nimble and strategically responded to the pause in SNAP payments last year, we grant $2.1 billion annually, and SNAP for 1 year benefits family to the tune of $3 billion. We cannot fill the gaps. And like businesses, nonprofits need sound policies, reduced red tape, and reliable funding to be effective partners. It is critical that philanthropy, our nonprofit partners, the business sector, and government work in partnership to find innovative ways to address community needs. We need to make sure that we center children and families in decision-making so that they can help shape their futures alongside their neighbors. Collectively, we have an opportunity to build an economy that works for Michigan families. Thank you. I'm going to turn things over to Yazid Moore.
Thank you, Regina. Families want solutions that help them afford the basics and stay financially stable. When we focus on what families need to succeed, good jobs, housing, health care, and access to affordable quality care, and their education for their children, we can create better outcomes. By working together, business leaders, policymakers, and philanthropic organizations can strengthen our workforce, grow our economy, and create lasting opportunities for children and families across Michigan. Now I'd like to open the floor for questions on the data and solutions you've heard here today.
What's one thing that business leaders and or policy leaders could do today? What's an action step that you take today?
For business and policy leaders, I think the action item they could inform or engage in today is just sitting down and talking about the real world problems that we're experiencing as employers, because we've got things that we can do, and I've explained some of the things that we've taken on internally to try and address these issues, but we really need policymakers to be there with us. Just like philanthropy can't be the solution, we can't also be the solution, right? Not going alone. We really need to partner with all of those groups, all the stakeholders, to come up with solutions that work. Because we simply a lot of businesses don't have the margins it takes to fix this stuff by themselves. Just like philanthropy doesn't have the deepest pockets it would take to solve all this themselves. So it's really a coalition that needs to be built.
Anybody else?
So I would say two things that are really essential for everybody in this space to take action. One is to find somebody that is outside of your typical sphere, somebody that you maybe typically don't agree with, and sit down with them and listen to what their needs are. To truly listen. Don't listen just to debate, but get a sense of what they're struggling with. And that's a way we can find common ground and build community and recognize the humanity in each other. And the second thing, policy and budget are essential. At the League, we really believe that our state and federal budgets are moral documents. They tell us who we value and often who we don't value. And it is essential to understand both tax policy and the budget policy if we want to make solid change in Michigan.
The one thing that I would add as I think about nonprofits and Michigan philanthropy is also being able to invite policymakers on site visits, right? So it's one thing to engage in conversation, it's another thing to actually see the work in action and also seeing the impact that the work is having on children and families in the state. So I really strongly encourage folks to take this opportunity, identify one or two policymakers, and invite them on a site visit, invite them to see the work that's happening in their communities, in your community.
And I would just add to all of that to do what you can to break down silos among issue areas. Almost every single area of public policy has some kind of impact on families and families with children in particular. And the more that we can start to be in rooms together and explain our perspectives, I will say that sometimes even child welfare, childcare folks are not always in the same room together, much less housing, transportation, and labor policy folks. So the more that Michigan can be moving towards a cohesive family policy that puts kids and families at the center and has a very clear vision and set of goals for what that looks like, the more efficacious everyone's work is going to be.
Hearing none on this beautiful Wednesday on the Blue Porch. So meeting the moment for families, communities, and state requires continued partnership. When business leaders, policymakers, and philanthropic organizations come together, it creates a transformative impact. And you can see that here today of being represented, fully representative. I invite you to learn more about what's on the line for Michigan families and how we can support them by reviewing the handouts we have available here. If you're interested in speaking with one of our panelists further, my colleague, Samantha Meinke, WKKF Communications Officer, can coordinate your requests. Thank you for being here. Have a good day.